우리가 지금 이 설문지를 작성을 해야 돼.
Hello, Mr. Yoder. I am Amy, the visiting nurse. Thank you for allowing me to come to your home. I was asked to visit you today so that we could talk about how you are doing and to assess the sore on your foot and see what needs to be done to help it heal. Please let me know about any other expectations you may have.
Nah, I'm fine except for that sore on my foot. You can just call me Red. Everyone calls me that.
Well, I'm a little concerned about Red's ability to manage the diabetes. You don't always follow the diet that Dr. Baker gave you, do you? And last time I got your groceries, you wanted more beer than usual. I'm not sure how well all these beers go with managing the diabetes.
I'll wash my hands. Please state your name and date of birth.
My name is Sherman Red Yoder, and I was born on the 3rd of May, 1941.
That matches my records. The patient is breathing at 18 breaths per minute. I'm going to check your pulse here in your arm.
Okay.
The pulse is 86 per minute and regular. I need to check your blood pressure. You will feel tightness around your arm as I inflate the cuff.
Okay.
The blood pressure is 129 over 86 millimeters of mercury. I'm going to take your temperature.
Okay.
The temperature is 99.1 degrees Fahrenheit. I'm going to take a look at you from head to toe.
Okay.
There is a dressing on the patient's right foot. Other than that, there is nothing to find on the head-to-toe assessment. I'll just take a look at your dressing.
Okay.
The dressing looks a bit dirty. I'm going to check your skin for any bruises, rashes, or other problems.
Okay.
There is normal skin turgor. His color is normal and he is not sweating. There is a dressing covering the wound. I'll do a couple of tests to assess your sensation.
Okay.
There is reduced peripheral sensation.
이제 전화할 거야.
I'm going to call your provider.
Okay.
I've explained the situation, background, assessment, and recommendation to Dr. Baker. He ordered topical antibiotic ointment and wet to damp saline-soaked gauze to the wound every day, and clindamycin orally, 300 milligrams 4 times a day for 10 days. To check the wound twice a week. So I will come back in a few days to see how the wound is healing. I have entered this in your health record. In addition, Dr. Baker would like to see you in his office. I can help schedule an appointment for you if needed.
No, that is not needed. I can do that myself.
이게 항생제 연고인 것 같죠?
I'm going to remove the dressing so I can assess your wound.
Okay.
아프냐고 물어볼 거예요.
Do you have any pain?
Thankfully, even though I have this sore on my right big toe, it doesn't hurt.
How bad is the pain on a scale of 0 to 10?
It's almost 0, I'd say.
Where is your pain located?
Well, the sore is on my right big toe, but thank the stars it doesn't hurt at all.
상처 한번 볼게.
I'll do a quick examination of your wound.
Okay.
The wound is free from necrosis and doesn't look infected.
심장도 한번 청진해.
Please don't move for a moment as I listen to your heart sounds with my stethoscope.
Okay.
The heart sounds are normal. The pulse is 86 per minute. I'm going to clean the wound to try to remove bacteria and any debris. This will reduce the risk of infection.
Okay.
The wound has been cleaned.
아까 주라고 한 항생제 연고 바를게.
Topical antibiotic ointment has been applied.
다시 드레싱 할게.
I'm going to apply a dressing to your wound so it won't get infected.
Okay.
I see that you have diabetes. Can you tell me what you know about diabetes and the connection it may have to the sore?
I searched the internet for the best way to treat it. There are so many sites about foot sores if you're diabetic. And I saw some pretty scary pictures. But then again, mine is not hurting, so it can't be that bad.
Judy, I understand you are concerned about your father-in-law, and I know that at times being a caregiver to a loved one and seeing that person functioning in a different way than you are used to can be challenging. It is very clear to me that you want Red to have the best quality of life possible. It is important that the team, including yourselves and Red, have the same goals in mind and that the interventions to reach those goals are agreed by all.
Yes, I agree on that. It is just not always easy to agree on the goals with Red.
환자 교육할 거야.
Red, the doctor has ordered a diabetic diet for you. Following the diet is very important in managing diabetes, as diet and insulin will work together to help keep your blood sugar under control, and well-controlled blood sugar will decrease the risk of complications. If you have any questions in relation to the diet, I can help with answering them. I can also make arrangements for you to talk with a dietitian who can help answer questions.
Yeah, that's also what the doc said. He always scolds me about eating too much sugar.
Not feeling the sore is common with diabetes. Your diabetes has affected the circulation to your feet, which is why you did not feel the sore. That can be dangerous, as a sore like that can get much worse before you notice it. There are many risks and benefits involved with living alone for anybody.
You can say that for sure.
You will need to put antibiotic ointment on the wound on your foot and then cover it with a dressing that has had a fluid called saline applied. I will be able to do this during my visits and continue to teach you how to do it, but I will not be here every day. Therefore, we need to come up with a plan about whether you or your family will do it on the days I am not here. It is important to keep the wound clean and protected. Wash your hands before you start to change the dressing.
Okay.
Red, as mentioned, Dr. Baker has ordered clindamycin orally, 300 milligrams 4 times a day for 10 days. Be sure to take the medication with a full glass of water. Take it at the same time each day and use the medicine for the full course of treatment. This is important since skipping doses may increase your risk of further infection that is resistant to antibiotics. In addition, you will also still need to take your insulin at the same time each day and coordinated with eating breakfast. This is a key factor in keeping your blood sugar under control.
Okay, I'll try to remember it.
그리고 이게 기입성 저혈압이거든.
Sometimes when you stand up quickly, you can feel dizzy or lightheaded. This can put you at risk for falling. When this happens, it is often the result of your blood pressure dropping when you stand up, or your diabetes can cause this. There are several things that you can do to avoid this happening. Stand from a sitting position slowly. When you get up from bed or lean down to tie your shoes, sit at the side of the bed for a moment before you stand up. It is also important to stay hydrated.
Okay.
The insulin is given for your diabetes. However, there are other important factors to consider in managing diabetes. The sore on your foot is likely from diabetes. It is important to check your feet daily for any red areas or sores and to wear protective shoes and white cotton socks. If you are unable to see the bottoms of your feet, ask John or Judy to look. You also want to monitor your blood sugar levels regularly. Typically, once a day will be appropriate. Be sure to wait 1 to 2 hours after eating to check your blood sugar levels. By keeping your blood sugar within the therapeutic range, your body can perform at its best. When you check your blood sugar, keep a log to show Dr. Baker. See the eye doctor, the dentist, and the foot doctor regularly. Diabetes can affect all areas of your body.
That will surely keep me active with all them appointments.
A good night's sleep is key to being able to function during the day. Staying active during the day and avoiding day napping helps with night sleep. It may be helpful to limit the amount of caffeine you are drinking. Alcohol may seem like it is a good promoter of sleep, but it often interrupts the sleep cycle. You may want to consider not using beer to help you sleep. While Benadryl can make you sleepy, as you get older, the side effects are often risky.
The days of drugs and rock and roll are over, it seems.
이제 알코올 유주 스크리닝 사정할 거야.
I want to ask you a series of questions about your alcohol use. Please know that there are no judgments in these questions. They are intended to help with planning your care. May I ask you these questions?
Sure thing. Go right ahead.
이게 그 테스트거든.
Red, thank you for going over this alcohol screening test with me. I would like to ask you some questions that will help me plan your care and make your stay here more comfortable. May I ask you these questions?
My stay here? You're so funny.
잠깐만. 이게 질문 선택을 잘해야 되거든? 질문을 또 잘못 선택하면 바로 점수가 까요. 뭐 해볼래? 이거 해볼까?
I have a series of questions I want to ask you about possible sleep issues. Please think about your sleep over the past month and answer whether you have had the issue 3 or more times a week, once or twice a week, less than once a week, or not at all during the past month. Do you understand the directions?
Got it.
이 사람은 9시에 자서 60분 전으로 깨고 새벽 5시에 일어나고 다 6시간 자고 (60분) 넘게 걸려서 30분 내에 잠 못 들고 이 사람 중간중간에 좀 잘게. 화장실 가고 싶어서. 화장실 가야 되고 숨 못 쉬고 이런 거 전혀 없고 이런 것도 없었어. 자는 동안 2번, 일주일에 2번 정도 수면제 먹고 이건 없었던 것 같은데? 이런 건 없었고 How much of a problem does it have to keep up? 이거 없었고 How would you rate fairly bad?
Thank you for telling me about your sleep. Later, when we do a team meeting talking about your situation with sleep, I'll share this information with the team and we'll be able to come up with some ideas to help you sleep better.
시간 없으니까 이거 제출하자. 백점 나왔네. 기록 중지할게.